Hello, and a very warm welcome to Health Talks. My name is Dr. Catherine Millington-Sanders, and I'm a GP in Kingston. Today's discussion will focus on normalising conversations about dying, and I'm delighted to be joined today by Emma B. from Magic Radio. Emma, we'd really love to talk about today some of your experiences, and could you tell us a bit more about your experience of maybe death, dying, diagnosis that might be difficult within families, or bereavement?
I've always been aware of it. I mean, when I was younger, when grandparents die and things like that, and you're always sort of aware of the emotion that floods through families, the inconvenience that it has on family life. And whether that was my mum's mum when she was up and down the motorway to Carlisle from Oxford week after week after week, you're aware of the fundamental impact that it has on people's lives. And as a kid, you sort of trot along to funerals of old people, and you get hugged and people hold your hands, and you don't really know what's going on, but you know that everybody's really sad and it's a difficult time. So those were always things that I'd been around. We were never shut as kids. We were never shut out of funerals of family members. We were always encouraged to go along. And I always, in a weird way, kind of enjoyed that, because it was a chance to see people. And even though everybody was pretty sad, there was always sandwiches, and there was always some fizzy pop, and they always, for me, and gratefully so, those early experiences of death and going to grandparents' funerals were always of old people. So which to a large degree, yes, is sad and and tragic, and we all have our emotional connections to family, to older family members. But for a grandchild, it always seemed like quite a nice thing. It was always quite positive. And it made sense to me, because they were old, and that's what happens when people die. They die when they're old. And so I guess in a lot of ways, that was a really perfect introduction to death. It wasn't I wasn't introduced to death in a massively tragic way early on. And then my mum died. My mum died at 65 from secondary breast cancer. And at that time, me and my dad, my mum's a nurse, my mum's medical, and my dad's a hematologist. And I think as well, coming from a medical background, all the sort of the frightening medical language has been lessened for me, which is a gift, and something that I've been very, very grateful for. But mum had decided very early on that she wanted to, because we could look after her at home. And we had carers in, and the local support nursing staff and oncology team would look after her at home. But because Dad was a retired doctor, we could do that. That was really brutal. My mum hung on for a long time, and I think it was absolutely the opposite of those sort of early memories of death and funerals. It was brutal. It was real. It was scary. And I saw someone disappear in front of my eyes, in front, over it was a period of about a year. And I think it's only now in hindsight that you look back and kind of go, that was how she wanted it to be. She was comfortable in her home. She had all of her things around her. She wasn't worried about things like not looking great, and there was, and being embarrassed about what was happening to her on a physical level. She was in a bed that was looking out of the window, so she could see the blue sky and she could see Dartmouth. It was really important to her. And even though in the run up to her dying was difficult and brutal and traumatic, and it was, and it is for many people, because you can't do anything about it. You can't do anything about it. It was. I'm so very, very glad that space that she had was how she wanted it to be. So for me, that was the most sort of profound experience of death that I have had. And it stays with you. It stays with you. But it also makes you confront something scary. And when you first start that path, you kind of go, I don't think I can do this. I don't think I can do this, but you do. And it took a long time to process, probably still processing. But it has made us think, and me particularly, think a lot more about how people die, how I would like to die, how my friends and family might like to die. And for that, there were many silver linings. You always have to find one. That was one of them.
Thank you. I mean, I was just thinking as you were talking, it's helpful. We often think about the negative parts and the enormity and the difficult and kind of talking about these things, but I love the way that you sort of highlight some of the positives that come with it. And I think it's so easy to forget that. My dad died suddenly at the age of 59 of a sudden brain hemorrhage, and I often reflect. I mean, it was really. Now it's easy to say this now, years later, but looking back, I was pleased for him that he didn't necessarily have to suffer, but it was the words brutal really do resonate, because just suddenly they're there one moment and they're not the next. We hadn't had any conversations about what he would have wanted. We hadn't even discussed funeral stuff. I mean, he was quite a sort of quiet, private person. But I sort of reflected on how could we not have had those conversations. So I guess when you were going through that with your mum, and it's interesting, because sometimes, not just because she was a nurse and your dad was a hematologist, doesn't mean that just because you're a medic that you want to talk about these things. So did you have conversations in advance, or what did you talk about? How did that go?
We talked, well, it was, and I think that's the other thing, is that even if somebody has time to be able to have those conversations, pain relief is such that minds go wandering and very quickly, and we had more conversations, I think, about the fact that she used to continuously think the Arsenal football team were coming to visit her at some point. And I was like, what? She was like, no, they're coming this afternoon. Morphine does funny things to you. And so, but there was a huge amount of humor in that. There was it was really fun to go back to her and say, what time is Paul Merson coming again, Mum? But I think, we didn't. She knew that she wanted to be buried. She knew where she wanted to be buried. She knew that she wanted it to be. She's a Christian, so she knew her faith was really important to her. She regularly had the local vicar come and give her communion. So those I guess actually those basics were in place. She had expressed those things. So details about songs, and I mean, her favorite hymn was in her. We actually had a memorial. She was buried, and then we had a much bigger memorial a while later. But she had her favorite hymn in there, and we knew about things like flowers, and things like she was always really embarrassed about her feet, her toenails. So we made sure that she was wearing socks when she was buried, because she would have been so embarrassed about her feet being seen. And so I think there was a lot that we had talked about. I think people who have a concept of afterlife in their as part of their belief system, there's a structure there already, and I think that's probably quite helpful for a lot of people, actually. So yeah, we had talked about it, but I don't think we we definitely didn't talk about feelings very much, and that is a regret. I do wish that we had talked about feelings more, about, you know, we'll be okay and you're going to be okay, and how will you deal with this, and that sort of permission for her to leave, and that permission for us to go on and have a successful life and a happy life without her. I think things like that are important, and it's easy to underestimate the amount of time you have to do that.
I find that fascinating. Can you say a bit more about why that's important? Because I completely, my mum, her mother died. There were four sisters, and she died of cervical cancer when I think she was in her sort of early 40s, and they didn't talk about it at all. It was in that era of no one talked about cancer, and they didn't even know that she was dying, and they weren't allowed to go to the funeral. And it was just, there's this memory of sort of forbidden things that people didn't talk about, and there's not even the verbalization of that it would have been helpful to talk about it, but it's so evident to me looking as a bystander growing up, going, why did you not talk about this stuff?
Yeah.
But what, you know, for people listening, what would the difference be, and what would you have wanted, you know, some of the words for her to sort of find for you?
She said to me once, "I'm really glad that I've had you," and that was the one thing that she said. I think there was, I'm not sure whether there was an element of my dad, of us trying, you know, because there's that thing, isn't it? We've got to be strong. We've got to be strong for them. And actually, this is a time when it's completely fine to not be strong and to have those cries and to have those hugs. I wish we'd had more hugs. I wish we'd said goodbye. I wish, you know, those, and I think, you know, particularly to have had conversations with her, I guess, about the permission, about a permission um to go on and be happy, and to, you know, not mope around being maudlin for months and months and months and years and years and years. I knew that she was really proud of her grandkids, and I think, you know, I think post her dying, I really wish we had as a family probably had more time to talk to each other. I talked to my brother about her a lot. I think it was more difficult for my dad, but again, he was from that you know, that generation where don't want to talk about it, don't want to talk about it, don't want to talk about it. And it's taken years. We now talk about mum a lot, but it's taken a long time. And I think even if it's letter writing, even if you write a letter to each other, even if you can't say it to someone's face, even if it's written down somewhere for, I think some more guidance, and more guidance from, I don't know who, but to you know, more suggestion from other people saying, why don't you do this, or why don't you do that? And to be honest with you, by the time I was starting to regret not doing that, she was under, you know, on so much medication that it would have been difficult. So again, you kind of come back to that feeling that, does it need somebody to be dying to be able to talk about this? Probably, of course it doesn't. And that is the point where we need to be talking about it, not when we're on the sliding decline. And I, you know, and so we do, as a family, we do talk about it a lot more now, in the hope that that won't happen.
So right, it's not just at the end, is it? Or when someone's had a serious diagnosis. I mean, and I guess this is what the podcast is all about, is how we normalize those conversations, so that it's about, you know, maybe having good conversations when you first go to school about what you're worried about, and then I know I'm thinking as a GP here, when you first have sex, or you're going to have contraception, or you're getting married, or you're getting divorced, or whatever that might be, these life moments of how do we talk about what matters most to you and the people that you care about around you, that people know. because then actually you feel empowered.
I've worked with lots and lots of great people, but there was one lady, was a team of people at Teenage Cancer Trust who were really hot on language as well, and being able to say things like death, dying. Everybody has their own way of dealing with things, but I think there are lots of euphemisms for dying as well that we kind of skirt round a lot, and and everybody has to feel comfortable in the way they speak. I understand that, but I think it's one of, everything about this is important. Place, medicine, care, language is important, and we say dying and death in our family. That's what we talk about, and the kids, I think, are comfortable with that word, and I think it starts with language, it starts with discussion, it starts with language and how you frame things, surely.
And you mentioned that your mum was super proud of the grandchildren, and those are your kids. I'm not sure of your family, sort of, how big your family is. So when you were discussing how your mum was, and as she got sort of closer to dying and then as she died, how did you approach that? What kind of age were they, and how did you approach that with your children?
So Billy, my youngest, was a bit young, was young, was sort of 4 or 5. 11, yeah, 4 or 5. Edie had a very close relationship. Edie's my eldest, and she had a very close relationship with Nana. And she'd gone on the train to see Nana lots of times and stay with her and Grandpa by the seaside. So she was very sad. She was very sad about it. But it was interesting because one of the things that, and she could see how, and Edie could see how sad I was and how tired I was. I think, Edie's a gorgeous human being. She's a carer. And so, she was very empathetic to what was going on. The flip side of that is that she probably absorbed a lot of what was going on, and was stressed and concerned herself. And she would talk a lot. But here's the thing: there were 2 things. Is that where my mum is buried is a graveyard in a beautiful church, in a beautiful countryside church, which is where my dad's family all come from, and a lot of the family are there. So we would take her down, and it's, you can sit on a bench, and it's picture postcard beautiful, and we would tell stories about everybody that was there. So there was a real sense that Mum wouldn't be on her own. I think that she was really worried about. She also got very upset at the idea that Grandpa would be on his own. So my dad's family have a very strong sense of family, which has been a gift as well. So we were always very kind of aware that Edie knew that Mum would be in good company, and that this was a place where she could come and see and remember her, and that there was a history of people dying, and they're all here. Also, one of the things that I remember telling Edie as well, which was, and we have this little thing that we talk about a lot in the house, is that when my mum died, and I went down I did a U-turn on the motorway because I got the call and I was coming home, so I had to go back. When that happened, and I went to see her, I went to see her body, and that was the first time I'd ever done anything like that, which was nerve-wracking. But oh my God, I'm so glad I did it, because, and I remember saying to Edie, that was Mum's body. That was not Mum. Mum has gone. And it meant everything to me, because it was, I didn't feel, I felt really relieved. I can feel the calm now. I felt really relieved that she wasn't in pain, that she was in a better place, wherever that was. And I was able to express that to Edie, and I think she understood that.
And with your younger one, because it makes such a difference, doesn't it? The way that we kind of approach different ages, because I think little ones, it's helpful to have that sort of narrative and journey, but sometimes people approach it, rightly so, in a different way. How did you find yourself approaching your younger one?
With Billy, I think she knew, again, there was disruption to her life, so there was, and mum wasn't there very much. I think she probably benefited as well from, family sort of closing ranks and all, being hugely supported. So my husband's family stepped up, so Billy got to spend a lot of time with grandma, and was really tolerant. And we would sit and explain, Nana's not well, so mummy's got to go and do this, and she was really, really tolerant about that. I think she can't really remember Nana, but she also she was at the funeral, she was at the memorial, and and I think actually, to be honest with you, at her memorial she was quite badly behaved, but I think by that point her tolerance for not being the centre of attention just about run out, and she was just like, enough already, okay, we've done this Nana thing for a long time now, okay, what about me? But again, and I am blessed with family. I am, and it must be really hard for people who don't have family around. I think both of the kids, Nana's, she was sick, she was in pain, she's gone, and mummy's really sad about it, and lots of people are, but she's not in pain anymore, and that's what happens. It's what happens. People die. And it's sad, but we all, and we talked a lot about it. But I think, again, Billy probably really benefited from a really intense period of feeling family very strongly.
It's really interesting as you're talking, because I mean, listening to sort of the children and young people aspect, and then your input with the Teenage Cancer Trust. I just wanted to know how that connects. How did you connect on that journey, and why is that important to you?
I had a couple of years. I had a couple of years out of radio. I just needed, so I went and worked actually first with Macmillan Cancer Support, and then with Teenage Cancer Trust, and we were saying, it's always sad when someone dies. It always is. But for some reason, I really keenly felt the tragedy around the teenagers and the youngsters who get sick, and I think it's just, for many of them it's not terminal, but they are just on the brink of sort of discovering themselves and going out into the world, and finding the wind beneath their wings, and their wings are clipped. But I learned a lot from the end of life team there. I learned a lot from the power of environment, what they do to make that environment as friendly as possible is incredible, and it makes so much difference. And and it can be a really, really nice experience, and putting music playlists together and getting friends round, and having those wards where they're able to have their mates around till really late, sometimes sleepovers as well, to be able to kind of and if you can have those difficult, really painful conversations with a teenager, then we can all do it. Then we can all do it. But it's so important. It's so important to them. It's, all this hope has just like sort of just dashed. And to be able to do that with some dignity and with some lightness and hope is really important. It's really important. I feel so passionately about that, because it's utterly devastating to lose a child, and it can still be done well. So if it can still be done well in that circumstance, it can still be done well for all of us.
And it's interesting. So I often, in my GP role of thinking, there are lots of different forms of loss, aren't there? I mean, there's that it sort of deeply affects. So although we typically think of people who are dying and they have a long process or maybe a sudden death,
Yeah.
but there I think miscarriage, sudden loss of maybe you've had a stillbirth, or there are
Yeah.
so maybe you had a loss of limb, or you've had a loss of your hearing or sight, or there are loads of things that actually cause people sort of deep pain, and that transition of going from one aspect of your life, but actually feeling the loss or some kind of crisis through that. And I think it's interesting how we sort of are able to talk about that quite openly. I think we've got a lot better being able to talk about it in society, but we've got so much further to go. But I suppose the things that I really love talking, and I know you are a super queen of music, clearly with Magic Radio. Have you had conversation? Do people like, I know, text in and say, well, what would be a playlist? You mentioned from the Teenage
Well,
Minstrels playlist.
I think they have. I mean, on Magic, music is so powerful, isn't it? Music is so powerful because it just, it reminds you of the good times. It comforts you in the bad times. It raises you up. It's, gives you hope. It does all those things. So music is really powerful. And often, I mean, every day we'll have a text from somebody saying, could you play this record because it was their favorite? Or could you play this record because we played it at their funeral? Or this was a song that we got married to. So in that sense, we can really help. And in the B household, our funeral playlist changes daily. We're all, with me and my husband, I'm like, you don't play this record when I'm dead, I'm going to come back and haunt you, okay? And that can be my one ultimate is Elton John and Rocket Man. That has to go on there. If he doesn't play that, he's in for a lifetime of hassle from a poltergeist. So and it changes all the time. And I love the fact, and I think as well, it is becoming more acceptable now for people to say things like, I'm not going to wear black at a funeral, because they wouldn't have wanted that. And even 20, 30 years ago, that would have been deemed fairly inappropriate. So, all of those representing people's death in an individual way, as opposed to an institutional way, is becoming much more acceptable, and that's really lovely to be able to do that. I remember when Damien, my husband's his grandmother died, and the kids were in the church, running all over the church, and it was full of noise, and it was exactly how she wanted it. So I think you're right. There's been a whole heap of progress, but I think we don't deal with loss very well at all. Generally, we don't deal with loss very well. Generally, I don't think. And like you're right, whether that's a relative dying, or a miscarriage, or watching people suffer from dementia, we still have a lot of work to do with loss. I think very much so, because it's not nice. It's not nice, and the instinct is to replace it, with alcohol, or a dog, or just to replace to fill that hole. And actually the hole is where all the emotion is, and loss is a relevant emotion. It's not something that you have to fix. It's there. It will get easier, but it's not something that necessarily has to be fixed.
It's interesting when I think about my dad dying. I mean, at the time it was just all consuming, and for years, just deeply, deeply, deeply painful. From getting up in the morning to breathing in and out, and having to go back to work, and as a doctor seeing things. Often similar. I remember working in accident and emergency at the time, and someone similar came in to the trauma room who'd had a stroke as well. And just the trauma, I remember, luckily, I had a really supportive consultant who was just like, Catherine, just take a breath, go. And the support I found was just incredible. I was very, very lucky. I know that not everybody's quite so lucky. And I think that's why with Dying Matters being supported in the workplace, and having conversations in the workplace this year, I recognised how crucial that was. And particularly looking back, I feel that I was cared about, that someone actually, and sometimes you find kindness, don't you, in the oddest places. So it's interesting. Sometimes you think when someone's died, you think, oh well, it's going to be your close family and your close friends that are absolutely there. They've got your back. And then sometimes you turn around and go, well, where are you? Where are my family? Where are the people that I thought would be here? And then you get kindness in the strangest of places, from neighbors or strangers or workplace colleagues, and you just, that you may not have been that close to. And I think that's kind of magical as well, to some of the positive parts that come in.
And you know, I know that when I would go down to Dartmouth, and I would go to Dartmouth so that Dad could sleep, so that I would stay and do a night shift and you know, sit up with her. And then eventually, you know, that the sort of care increased and somebody came in, but because she would get up and wander. But often you would open the front door and there'd be like a flask of soup on the front door, and not even necessarily, you know, with a "it's from me down the road, thank you very much." Sometimes it would be anonymous. I mean, we always knew who it was from, but you know, and those and I think those gestures mean everything. They just know, you just know that somebody is thinking about you. And those sort of little kind gestures can mean everything, as well as the you know, the wailing telephone conversations you have with your best friend. And you know, and you know, my best friend was on tap all the time through it. And I will be forever grateful for that. Equally, you know, those moments where somebody just rocks up with some bread and milk saying, I, you know, saw the car hadn't moved for a few days, thought you might be running out of basics, is all really gratefully received. And you know, and there was when I'm just coming through breast cancer, so I had breast cancer over Christmas and through, and I came back into work. Well, I'm fine, everybody. I'm absolutely fine. I'm through the other end. It's all okay. It's all okay. I got off lightly in comparison to a lot of women, but like coming into work, and there's one girl who is I've known for a while, but I don't work with her. And she saw me coming through the door, and I just went, oh, like this, and just like had a moment of panic. And she just walked over, just gave me a hug, and just gave me a hug and just went, we've got you. It's okay. We've got you. And I think they don't need to be huge gestures, but I think in the workplace, particularly in the workplace, where you're playing a different role, and you want to work, you want to come back and fulfill that professional side of your personality, you want to do those things, but there are going to be moments where you wobble. And I think, you know, an empathetic workplace is something that trickles down from the top. It benefits from structures in place, it benefits from training, it benefits from talking. And whilst the sort of, you know, again, it might not, you know, it might be everything from having extended bereavement leave right through to just opening your eyes and seeing when someone's in trouble. And you know, working in a job where I'm paid to be happy all the time, that was a really welcome hug. That was a really welcome hug.
And I mean, all the evidence from, there was a large amount of research with so many people dying during the pandemic and looking at bereavement. So the evidence shows that sort of about 70% of people are affected by grief and bereavement in the last 5 years. And for every death, at least 9 people are probably affected by that death in a significant way. And that's not really including, you know, people within the community. You kind of know someone down the road that has been affected. So the kind of the gross effect on all of our community can really be quite extended. They also show that the majority of people are completely supported by your community, and so friends and family and neighbours and, you know, people in the shop or your hairdresser or whatever that is, and that's a lovely component. And was there ever a time that you've experienced where you felt, you know, so alone that you didn't have support?
I do actually. I felt very supported throughout with mum. I think there's a moment probably for everybody where they kind of the realization that the wider circle are done now. And you know, life goes on, and there is a moment when that happens for everybody, I think, who's lost somebody. You know, you kind of go, oh okay, we're back. Okay, we're back to normal, fine. There's a little bit of that with my cancer diagnosis, you know, that you kind of go, oh okay, no, I'm fine. I'm still processing, actually. I'm still processing over here. With mum, I felt very supported for a while, and I don't know whether that was because we had Macmillan nurses in, and you know, and I'd worked with them, and you know, whatever, and mum was A, so everybody loved her. So you know, that was always going to happen. I had 2 ectopic pregnancies in my early life, and I felt very lonely then. That was really hard. I wasn't signposted to anywhere. It wasn't handled very well medically. I definitely didn't hear. I definitely didn't hear any signposting to, you know, where you could go. And I dealt with a lot of that on my own. I felt that was, you know, I think again, that was people sort of brushing that off as, oh well, we all go through it. That's what happens to women. Just, you know, it's a women's thing. You'll be fine. You'll get over it. And you're like, what? Hang on a minute, you know. And I felt that was. I remember standing in Hampstead High Street in London, where we lived at the time, on the corner, feeling absolutely forgotten. And I can see the day, and I can see where I was, and I didn't know whether to go left or right or whatever, but I just didn't know how to handle all the thoughts and emotions that were in my head. And at that point, and I think I felt, and also that's the other thing about losing a child, or you know, in pregnancy, is that everyone around you is having babies. So you don't want to rain on their parade. You don't want to bring everybody down because they're cradling, you know. So there was a lot of, I felt there was a lot of pressure to not talk about it. And certainly at the job that I was in at the time, I had been contacted, and I've spoken about this before. I had been contacted by a publication, a magazine, to say, do you want to come and talk about loss and postnatal depression and you know, your topics? And I said, yeah, I'd love to. That would be amazing, because we don't talk about it enough. And the press team that I was working with at the time said no. They said, no, we're happy radio station. You don't do that. And I was actually told not to, which is something I deeply regret coming on. But you know, yeah, that was difficult. Those difficult times.
I think that's a sign also of the times, of how hopefully things are changing, but it's still incredibly, I think, women having permission to be able to say, actually, I'm grieving the loss of a baby that I was looking forward
Yes.
to, that I hoped for, that I'd planned for, or maybe not planned for. But either way, it doesn't matter. That sort of deep loss, certainly, definitely in general practice, it's absolutely crushing, that can affect women.
Really,
Yeah.
you go all the way down, you go all the way, and you know, the brutality of losing a child in pregnancy, it you know, it's really, it's not, there's nothing nice about it. And I think there was yeah, and the industry that I was in at that time was very much you know, smile and wave. And you get on with it. And if you're not going to get on with it, then there will be someone younger, probably skinnier than you, that's waiting in the wings to come and take what you can't do. So that was you know, not encouraged at all. Skip forward to where I'm working now, and my you know, my breast cancer journey. Oh my God, I mean, couldn't be more different. So we have come a long way. And you're right, and we should feel good about that. We should feel encouraged about that, because there was a lot of work to do, for sure.
I was just thinking, just there, as remembering the other halves of the partners of people that have potentially lost stuff, whether or partners that are caregivers or partners that are not necessarily with a diagnosis, but they are loving someone that has just got a diagnosis or been through a diagnosis. And I think sometimes it's because we all have different needs. If you're diagnosed with something, it's an immediate part, and it's about, and the focus is, what am I going to do next? And it's very sort of much following the journey of that's potentially put in front of you from medical teams, or choosing what options you're going to be going through. But I think sometimes it's also really tricky for the loved ones, because they're processing, what does that mean for them? What does it potentially mean for a whole family? What does it mean for the person that they love? And I think it's interesting because it's not the same, and it's a bit like grief in general, is that everybody's so different. It's so unique to that person, and you kind of think, I was surprised myself when I was going through, obviously with Dad dying, that different family members were different. I was like, why it was, I remember literally grappling with, why are they not feeling the same? Why isn't this not obvious? This is how I'm feeling, so surely they were going to be. But it was interesting, all these different feelings and processing at different time spans. It took me ages to talk about Dad. Like, I completely blocked it off and I couldn't go there. It was so painful. And oddly enough, because I really enjoy talking about this with patients and family and friends, but for myself, it was this realization of, this is way too painful. But but other family members really deeply wanted to. So what do you do when you're in that situation where you've got different loved ones, and you normally really cope and go through family life together, but then you've got very different personal needs to get through, loss and a time of difficulty.
And loss can be incredibly selfish, and not in an intentionally in an intentional way, but it is because it's deeply personal. It can be very selfish, and and the irony is, of course, is that your needs are, whatever your needs are, they're entirely justified and relevant. And I think for Damien, watching me go through losing mum was so hard, not least because he had to pick up of the practical day-to-day things that meant he was 15 times busier than he would normally do, and he's trying to maintain a job, and he's trying to maintain a happy house, but also because of the unpredictable nature of my emotions at that time. And sometimes I'd really want to hug, and other times I'd be like, I mean that's, he's so used to that now, but sometimes you would really want to be quiet, sometimes you would want to talk. And for friends and family and partners to judge that, and to judge when to step in and when to ask, is really, really difficult. And like, as much as there are people in the family deal with dying and death in their own personal way, you are also dealing with dying and death in different ways on an hourly basis, sometimes in the days and months afterwards. And I think those huge jumps in emotion sort of eventually level out. But I think when somebody takes a sort of, if somebody has lost someone and they're taking a worrying turn that's damaging themselves, then I think people should be brave and step up, and step up and with the kindest of intentions to say, I think you need help, or we need to help you. What can we do? How can we be there for you? I think otherwise, if that grief gets dealt with at some point, then some point is okay. It might be that you actually don't want to talk about mum for a bit, and that's fine. But I think if it starts to affect, it's when it starts to affect your life adversely, when it starts to manifest itself in unhelpful, and when you're self-destructing. And there's a self-destruct element of all of us, because you're doing everything to avoid dealing with the pain. You're doing everything to avoid it, whether that's numbing yourself because I can't face those emotions, just to try to turn away from that pain, just everything to turn away from that pain. And that pain is going to have to be faced at some point. And with hindsight and time, it's not sometimes as bad as you think it might be, because we're flipping strong and wonderful human beings, and we can do it.
Yeah, and I remember waking up thinking, "God, I'm surviving again, like how with this Groundhog Day," and
Yeah.
it's I think my reflections from sort of being in general practice and working in hospices is that that's all normal, and actually just being able to say it is really normal to feel all of these very, very difficult, deep, however crushing or brutal from your words, um, that's normal, that's okay, and really,
And
if it
that's,
does start,
I think that's it, isn't it? That there is still some elements of kind of going, okay, enough now. Let's get on with it. I mean, you know, there's a friend of mine who lost their husband to bowel cancer about 3 years ago, 40s, mid to late 40s, 2 young children. That whole world falls apart, as you would expect it to. They're fine now, and they're great, and they will, you know, it's changed their life forever, as you would expect. But I know that there were people saying to her only months later, do you think you should get back on the dating game? Like maybe we should go out, and it's like it's normal for me to be feeling sad. Like I am totally within my rights to wake up and have a cry whenever I want. And it's absolutely fine to be doing that. And the best thing that you can do is to say, it's okay. It's okay. I'm here. Here's a shoulder. It's fine. You know, I
let's talk
don't
about
need to join Tinder. That's what I don't need to do.
But let's talk about, so what are some of the things, the pet hates of what not to say? Because I remember someone a year later, I was crying at my dad dying, and they went, "Oh, get over it, it's a year already. I mean, come on, let's move on." I mean, that was what so I was like, never say that. You know what? But I think people do with the best intentions. Often people are trying to be helpful and they struggle to go, well, what
Yeah,
do I say? Let's just try and move on, because it's really difficult to see a loved one in pain, or
yeah,
someone that you care about, or just someone in the office. You want to help them transition. So sometimes I totally get that people would go,
yeah,
oh, come on now. It's, you're a year left. Come on. That seems a
yeah.
long time. But for
I
some
think
people,
that like mentioning amounts of time for a start is a big no-no. Like people take as long as they take. So, you know, there isn't a textbook that goes, you're allowed to grieve for this long. It takes as long as it takes, and that's the end of it. I think one of the you know, the one big thing to say is I don't know what to say, because then it kind of puts the ball back in my court. Then I have to tell you what to say, and I'm like, what? And actually, it's just if you don't know what to say that bit in your head. You know, the I don't know what to say thing is that you don't have to say anything. You don't have to say anything. You just have to stand there and be there with me. You know, and you know, a cup of tea solves a million problems. And you know, just being there. I think saying to people, I'm there anytime you need, you know, anytime you need me, I will pick up the phone, and be true to that. And even if it's you pick up the phone to say, I can't talk now, give me 5 minutes, I'll be somewhere where I can. But you know, yeah, the I don't know what to say thing annoys me, because it's then kind of saying I don't want to be responsible for what I'm saying, and I'm just like, well, I don't want to be the last thing I need right now is to be responsible for what you're saying. So, you know, I think there's that thing, just, are you okay? Basics. Are you okay? What can I do? Do you want to cry? Do you want me to offer advice? What, you know, do you want me to offer advice? Do you want me to just be here? Either is fine. And again, you know, those little gestures, of of just a card through the door, or a text, or some soup, or like stuff that comes with no strings attached. All that stuff that comes with no judgment, no strings attached. Um, uh, you know, it's not conditional. It cannot be conditional. Is all beautifully received.
I think you're right. Just sometimes acknowledging, we are so sorry to hear that,
Yeah,
so and so has died, or such and such has happened to you, I think is really important. Validating that someone has,
validating.
and
Yeah,
acknowledging someone's got true feelings that is enormous for them. We may not understand what it might be like for them, but actually we can just sit there. And I think the other part is just knowing that you cannot fix. something that is just so potentially enormous for someone, but just being able to listen and be there and be curious about what's going on for them can be really quite cathartic, because
That's a
sometimes
good word. I think that's a good word, and I wonder whether or not that finds its way. That sort of that curious word does, yes, and ought to, and probably does for you, find its way into advanced planning. Curious about what people want, asking the questions, because we tend to withdraw, don't we, from asking questions completely. So, you know, and asking questions is a really good way, even if it's, so what kind of cancer is it? You know, it might sound quite macabre, but in a way, it's a distraction. It's a method of processing information for other people as well. And you know, for you, I guess, does that come into, lots of questions must come into advanced care planning?
I think that, I mean, the words I love using are what matters most to you, what matters most to you and your family. When you're making any decision making, I think because we're humans, we often process things by talking about it. And so you can only sometimes do that as much as you can in your head. And sometimes we need that. We need that space and that time and the quietness, as you were saying, to be able to reflect and digest some of it and just be able to let it come to the surface of our mind, to know that it's now conscious from that deep subconscious of trying to block things out. And that's normal, that's safe, that's self-preservation. But then there also comes a time, I think, when people get to, actually, how do I get through the thinking part of what's actually happening to me? And I think my experience is there is definitely a time where having someone in front of you to say, well, if you became sick enough to die, if you were going to have these sort of treatments, if we're talking about, you know, surgery or chemotherapy or a new diagnosis of dementia, and if you're losing potentially some of your mind gradually over time, what matters most to you now? What's going to matter most to you in the future? What matters most to you about, you know, being cared for, where you might want to be cared for, and does it matter? You know, sometimes you can throw it in the bin and go, that actually, I really don't care about that. That is not on my list of things that I want to consider. But this, my dog or my cat or the goldfish, whatever it is, I'm crazy about pets and animals. So, you know, they would be top of my list of all the fluffies. They must be looked after. But, you know, what is it? Because I think, I suppose something, my reflection is that if, when I haven't asked, then I've learned things when I have asked that I would never have known. And the secret is of having two human beings chatting, you can really start to understand what is in that person's mind. And that can change, you know, it's what matters most right now.
Yeah.
Or it can be enormous and you can be very sort of unspecific about what matters most in general.
Yeah.
But being able to, I think sometimes
Love
using
those.
the language.
I love those words. I love those words. I love those words. So we go through our wills, and actually that idea of what matters most is part of that. And it's really interesting. And you know, whether you know, are there everything from specific, oh God, I haven't even thought that my wedding ring might go somewhere, or you know, that those kind of things. It's a really interesting process to go to. And if somebody wanted to learn more about the work that you do, what would they do? How do you get somebody, how do we get people talking about this better earlier?
So there are lots of ways. I think, I mean, so firstly, we've kind of talked about our key people in our life. So just having those conversations with people that you love. Basically, if your other half or your caregiver or someone that's important to you knows what's important, then those are going to be your people if something happens or you suddenly couldn't speak for yourself, and you know, you're feeling so ill or you're in a bit of a coma, you're slightly delirious. That's the time when you want that person next to you to know. If you don't have someone, there are ways of writing it down. So for us, we've got the Universal Care Plan for London. So that's a digital personalised care and support plan that you can put your wishes. It doesn't have to be about end of life, but it's really helpful to know some of those key bits of information. You know, what would happen if you became very sick? Would you want to go to hospital? What treatments you may or may not want? And what matters most to you? Is there a cat at home that you actually do want someone to go and make sure is all right? So being able to document that and share it with different healthcare professionals, I think, is vital, because you know, you may not be in hours. Most of the time we get sick out of hours and your GP isn't open. So although we want our GP and our sort of family practitioners to know, we want the ambulance service to come if they come in the middle of the night, or there's a doctor that doesn't know you. So having that written down, I think first step, family, friends, key people that are around you that are your supporters. Next step is to make sure that your health and care professionals actually know about it, so we can support those wishes, because ultimately we all want to do a good job and we want to support what matters most. But if we don't know, then that we have much less of a chance to be able to support that and ask the questions early on when you're still at home, and what you may have wanted. And sometimes it's very easy to transfer someone to hospital otherwise without knowing those kind of wishes. And then there are loads of amazing charities. You mentioned things like the Teenage Cancer Trust. So depending on sort of your age, your diagnosis, we've got Marie Curie, which I work for, and another role nationally. And they've got amazing resources that help sort of signpost through death and dying, talking about it. There are talk lines that people can actually talk to if you need another human being that's independent. Lots of those, some of them are sort of 24/7 as well. And then I suppose just being able to, have those other charities. South West London, we've done some fantastic work, with all my colleagues. We've worked so hard about getting signposting and resources. So we've got a wonderful South West London website that are specific end-of-life care resources. So where are the pharmacies 24/7? If you need some medications or you need end-of-life care drugs, where can you go? That's to support professionals, but also, people going through experiences. And bereavement, we've done a mapping exercise. So basically that means we've looked at where are all the wonderful bereavement sort of charities, support groups, where you can get counselling, where you can get sort of just groups that happen in the community and meet up across different cultures. And we've worked with a number of different sort of communities from different cultural beliefs, and because everybody's different, and I think culture is really important. So we've got a South West London website that's broken down by all the different boroughs. So if you're in Kingston, you'd click on it and it's connected Kingston, and you'd have this sort of wonderful choices of, if you're going through grief and loss, whether it's from having a miscarriage, whether it's all the way through planned death and dying, someone's died from suicide, whatever it is, there's somewhere that you can actually turn to for support. And I think at the end of the day, we've kind of said it's unique for everybody. We don't know when we actually are going to need it most, and everybody's different. So just being able to know it's there and tap in to some of those resources and be able to look for help. And they're also downloadable. So the Kingston Authority, local authorities, done incredible work about having how-to guides. So planning your funeral, all the different things that you can have done if you don't have enough funding, what you can do to try and get support. You can tell I get really excited about this and make sure that all our residents have that support.
No, it's really nice. And hey, it's a weird thing to say, being passionate about dying, but you are clearly passionate about dying, and that's how it should be. It's going to happen to all of us, and if if it's going to happen to every single one of us, we ought to be better at it.
I agree. And we've also got, this Kingston Hospital that's very kindly been leading on this with us. We've got wonderful, partners of Kingston Hospital. We've got amazing hospices in South West London. We're really lucky. We've got Shooting Star Chase, our children's hospice.
Yeah.
We've got wonderful GPs. I love our passion from our GPs and community nurses, that the whole team, it's how our team wraps around and supports people. And then also looking at, it's everybody's business, death and dying. It's not just a healthcare professional. You want the right information and support, and you want to be able to get to those resources. So that's where the websites and things come in. So just, I mean, ask your healthcare professional of how you can get some access if you're not a Google fan, and don't have digital access. We're really there to help and support, but also reach out to your community, reach out to your family and friends, and don't be afraid to say, I am struggling, and that's okay. And there are things that we can do to help and support you.
And make soup.
Thank you so much, Emma B, for a really insightful discussion, and thank you all for listening.